rising cost of health care in the U.S. continues to pinch the wallets of many Americans. Experts say that it's important to fully understand your health insurance coverage. This can help you avoid surprise charges. There are also other ways to help manage the rising costs of health care in the country. Today, we are joined by Mario Payne, a certified financial planner. Thank you so much for coming on the show. We wanted to start off, how does understanding your health insurance plan help us?
That's a great question. First off, you have to understand what you have, right? From a health insurance standpoint, it's a few different policies that you get to pick from. One is a PPO. Now, that's the most costly, so that might not be the best for our pocketbook, but we can pick any doctor that we want. It's out of network costs, but we are able to really dictate who does the care for us. Another insurance plan is an HMO. Now that's in network. So we have an employer sponsored plan, whatever doctor is in that plan, we utilize. We have a primary care physician. So then he or she refers us to specialists if we have any type of problem. And then we have a high deductible plan. Now those high deductible plans, that'll be the best for our pocketbooks. However, though, it does come with a high deductible, and sometimes you might spend less, but it might cost you more over time.
Can you talk more about a health savings account or a flexible spending account?
Great question. So a HSA or FSA, if we want to use acronyms, it allows you to use pre-tax dollars. So these are dollars that are pre-taxed. We're able to have those grow in an account, in an investment account. We all love that as the stock market continues to grow. But with that, we can use that money to pay for health costs, for specialists, for co-pays, anything related really to health care costs we're able to pay for. Medications, we all know as time goes on, medications do not get cheaper, they get more. We can use that account to pay for those things that allows us to save money in our pocket and not pay taxes, which is always good.
What should people do if they're faced with a large medical bill?
That's tough. Well, the first thing we recommend is you want to negotiate, right? Just because we get that bill doesn't mean we have to pay the full bill. We definitely want to call the billing agency. We want to call the doctor's office to see if there's any wiggle room. Also, sometimes the bill that we receive is not the true cost because it's not ran through insurance. So we do have a large bill. We also probably want to talk to our insurance provider, have a conversation with them and see that they run the insurance. Is this covered? Why is it not covered? And through that conversation, prayerfully, that'll help us decrease that bill.
Can you talk a little bit more about how someone can utilize preventative care and things they can do overall to help stay healthy?
Yeah, preventative care is huge. And that goes from anywhere from early screenings, right? So if we go for us guys, go get that prostate checked earlier, for females, get the mammogram done earlier. That definitely helps. Also, how we eat, right? Are we drinking enough water? We all know we're supposed to drink 6 to 8 ounces of water a day. Now, do we all do it? That's another thing, but things of that nature. A lot of people are going plant-based, where they're cutting back on their diet. They're eliminating meat from their diet so that they can digest their food better, so they can stay healthier that way. So those are things that we can do. Some people are doing fasting, where every 3 months, that they fast for a week to get all the bad stuff out of our body so that we can perform better with our body. So those are the things we do preventative care-wise that allows us to stay healthy.
Some great things to keep in mind. Thank you so much for taking the time to come on our show today.
Thank you.